My name is Paola, and I will be talking about a drug that not a lot of people know about, but that is very dangerous, and you should be informed in case you ever come across it. So, first, I will give some background information. This drug is called Wonga, and it originates in Durban, Africa. Wonga is a mix of different things. It is rat poison, soap powder, and the main ingredient ARVs or AIDS medication. This is usually smoked.
Sometimes there's no turning back.
People add Wonga to usually marijuana, but it could be coke, um, and increase the drug's effect. Uh, However, it can also be injected, um, but usually it is smoked. The history behind the fact that the use AIDS medication is that Africa has a big AIDS problem, or HIV problem. There's roughly 23.8 million people that are positive for HIV.
The stigma associated with the infection has discouraged many young people to present themselves for screening, and experts warn of an impending health crisis.
Um, Unfortunately, a lot of them do depend on the ARVs, um, but they're unable to get them because people are being mugged for them. That's how severe this problem is for the addiction. People are going out of their ways to mug clinics and patients that are just leaving the clinic and taking the medicine that they need in order to make Wonga. Now, this drug could make people resistant to ARVs, which is damaging because some of them need them to stay alive. This drug is extremely addictive, Wonga, that is. One hit costs about $3. However, addicts need a lot of hits per day. Um, and usually, the people that do consume this drug are too poor to afford it, so they resort to things like stealing and crime, and some of them even go as far as to make themselves test positive for HIV so that they can obtain a steady supply of ARVs. Now, the mechanism of action for this drug can be a mixture, considering the drug itself is a mixture of different harmful yet common things. So it can block the reverse transcript to disrupt copying of HIV genetic code, but it can also prevent the blood from clotting since there are traces of anticoagulants. Um, However, I do believe that it could also affect your immune system because going back to the part where I said that it could be injected, there's actually this method people use where somebody will inject the Wonga and then the second person will draw blood from the first person and inject it into themselves. So that can you can contract a lot of different things from that, including HIV. So, some of the neurotransmitters that are affected by Wonga would be euphoria and GABA. So, some of the side effects that Wonga leads to would be anxiety, aggression, really severe stomach cramps that could make you feel like you're dying. It can slow down the heart rate and lungs. So, if a person tries to stop taking the drug, they will experience severe body pains and abdominal cramps and flu like symptoms. This drug affects the autonomic nervous system. The sympathetic division is in charge of accelerated heart rate, and according to my research, this could lead to increase in heart rate and could lead to the heart and lungs reduction, which will result in death. I would have to put Wonga at a schedule 1 since it is so harmful and there's really no benefits from taking this drug. Um, I will put my sources right here, and I encourage those watching to take a look and inform themselves on the matter.